DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, Dr. Dan here. Thanks for joining us today on DocTalk. We're going to have a great show. It's one of those shows that we enjoy doing. It's talking about calving disorders. Dr. Matt Miesner from Kansas State's Veterinary Health Center is going to be here. It's going to be a great show. You're going to learn lots. I'm going to learn lots. We'll see you after the break.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Matt, welcome to the show.
Glad to be here.
Folks, this is Dr. Matt Miesner. He's here at the Kansas State College of Veterinary Medicine. He's over in the Veterinary Health Center, where he is an associate clinical professor in the Department of Clinical Sciences. And Matt, we're going to talk about calving, and we're going to talk about, and that's all right, you're a clinician, the beeper's supposed to go off. That's when we get somebody that's in live, in action, he's on call, it's probably a dystocia, we're going to have to take a break. No, just joking.
Sound check.
That's right. Let's talk about calving and normal calving as things progress. You know, I think that the one thing we always kind of lose track of time, we lose track of what's going on with that heifer, but there are different stages, right?
Right. None of them can read. I've never not met a cow that could read a book yet, but there are some predicted times that we need to look at, and times when we need to act, and times when we just need to leave them alone as well. So we go through stages, and there's 3 stages of calving, and the whole process is what I would call is prep, push, and placenta. It makes it pretty simple. So the first stage is stage 1, which is prep phase, and that's leading up to it, and all the things are getting relaxed, and the cow's getting ready to make enough opening to get this calf ready to go. And then there's the push phase, which is the actual labor, and then that should be pretty quickly. And then the third one is the placenta, and so after that the placenta should pass, and we should have some time for the cow to get ready to raise the calf.
So when let's get into that prep phase, and I assume that's when she starts to go off by herself and different behavior and
isolation. Some people, if you see them in a stall, if they're confined, they'll kind of nest, they'll kind of do those kind of things. Cows are experienced at this thing, and it's pretty fast, and sometimes we don't even notice it. One day she looks okay, next day she's got a pretty good udder, and everything's starting to look relaxed, and man, you're ready to go. Heifers, learning the ropes, it could take weeks, sometimes for this to prep. Udder filling, ligaments loosening, all that stuff, so it takes time.
And then, so that has a real varied response, and there's no hurry there because we're getting cervix dilation, and once the cervix gets dilated, then we enter that push phase.
Right.
Is there more of a time once they start pushing?
Yes. So again, cows most of the time, sometimes it's just a cough. Out comes the calf. So within a half an hour, once they start, that water bag breaks and they start pushing in the cow, they should be out. Pretty quickly, within a half an hour usually. And then the heifers, they take a little time. Got to dilate and loosen things up, and it could take up to an hour. But the bottom line is, in that push phase, if things aren't happening pretty abruptly within an hour we need to intervene. And sometimes it takes a heifer longer to get it out, but I like that hour kind of cutoff.
Cool. Well, now that we've kind of gone through normal calving, that'll lead us in right after the break. We'll talk about some of the dystocias.
Right.
All right, folks. Thanks for watching Doc Talk. More with Dr. Matt Miesner on call after this.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Holt Tripp, a Kentucky native, is a fourth-year student at Oklahoma State University Center for Veterinary Health Sciences. He is pursuing a dual DVM MBA program. After graduation, Holt hopes to own and operate a diversified research and consulting practice specializing in feedlot and stocker cattle production systems.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner, and we're talking about calving disorders or normal calving, and now let's move into dystocia because we got to the push phase. We've waited 30 minutes and nothing's happened. And as a producer or a rancher, what's the first thing we need to do?
Frequent checks. I mean, having a plan. I mean, is it going to be now? We've watched her and we've seen if she's going to have problems. Is she showing signs of stress? Is she really laboring on this situation, or is she just kind of pacing? But having a plan for restraint, getting her caught, squeeze chute, set of panels or a rail that can be opened up, someplace to safely get her restrained, and then do a good exam. And most of that is having a good visual and maybe even palpating exam, kind of cleaning her up and making sure everything is coming through the birth canal okay, if you're comfortable with that. If not, that's the time to say it's time to call the veterinarian and have them do that. But, having that ability to have her restrained safely certainly helps the veterinarian be more efficient if need be at that point in time, and can get a good exam. Make sure everything's positioned right, nose, front feet, and everything's coming through the canal. Sometimes intervening there is the easiest way to go.
Yeah, and that's the other thing. I think that we overlook the restraint part because there's nothing more frustrating than a cow she's trying to have a calf. She doesn't know what's going on. She's getting up, she's pushing, she's getting up, looking around to see where the calf is. And then when you show up as a veterinarian or as a producer, you're trying to figure out, how am I even going to check this thing?
Yeah.
And the safety of you, your family, your practitioner, and the cow is important.
Right. Yep. And having a way to easily, efficiently get her in there too. Not having to work her too hard to get her to a point to restrain her. So planning ahead, that's part of the calving problems that we're looking at. So as far as these dystocias go, and then there's plenty of producers out there that are have delivered tons of calves, but there's always going to be that one that you're going to go, something's not right, and things that we see as veterinarians, or especially in the clinic, is the odd ones. And I've seen things where we've had twisted uteruses or uterine torsions, and some of these conjoined twins, and the bizarre things that, they're still the most experienced producers. Sometimes goes in and just says, whoa. At that point in time, if you have the ability and you have a good relationship with the veterinarian, it's probably a good idea to call them too.
I thought they just, the experienced ones called us when it was snowing or
yeah.
when it was raining was more than they had seen.
But it's always good to call early, because, veterinarians at this time of year might be traveling the ridges doing a lot of this, and so it's nice to have them be able to make a plan. They might be on their way by that direction.
So when you reach in there, you want to feel 2 feet ahead.
Right, yep. And then we got to figure out which feet they are. And if you look at the way that feet bend, the front's knees and fetlocks bend the same way, and the backs are opposite. And so there's a bunch of just systematic exams that we do at that point. And knowing if that calf's going to make it through that birth canal. It might just be a giant calf, or head turned around. There's a whole bunch of different situations that we can get into and make a plan. And at that point, we want to see progression. And so once we start, then I go half an hour time.
Cool. We're going to take a break, folks. When we come back, more with Dr. Matt Miesner on calving problems.
The BQA tip of the day, sponsored by Beringer Engelheim Vetmedica Inc.
This is Shane Terrell with Production Animal Consultation with today's BQA tip of the day. Today we'd like to talk about prevention of hardware disease. Our primary places where we can pick up hardware is, first of all, frayed cables along the feed bunk. We want to monitor our facilities, make sure that we don't have areas in which that cable is falling into the feed bunk. The other area where we can pick it up is primarily in our roughage. So first of all, we want to check our magnets within those grinders, those roughage grinders, to make sure that we aren't picking up metal there and removing that. Our last area for control is magnets on the feed truck. First of all, on the feed truck, we need to make sure that this feed is mixed well so we don't have clumping, which allows the feed to go by and allows those magnets to pick it up. If that hardware is within the clumps, it doesn't allow for that magnet to pick that up. We want to check these daily to clean those off and make sure we aren't running into areas of hardware.
It must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
Beef producers asked for it, and the wait is over. Enroflox 100 Enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease. With the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle. Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner, and we're from the College of Vet Med at Kansas State University. We're talking about calving disorders or getting that live calf on the ground, and we're talking during the break. You have 3 goals.
Right. Number one is, to get me a live, viable calf, so we want this to be efficient and easy on the calf. Number 2 is preservation of the welfare of the cow, so pain, welfare, distraughtness, all that kind of stuff. And then 3rd is maintaining her future reproductive soundness. So we don't want to injure things bad enough that she's not able to breed back. So I have those 3 goals going into each one of these situations.
Yeah, and we want to keep her in the herd, and and then the feedlot dystocias, we're worried about the heifer, not necessarily the calf. Because we're in the business of producing beef.
Right. And so the best way to do this is to be efficient. And so I look at my watch, it's time flies when you're having a good time, and I want to be having some sort of progress about every 15 to 30 minutes. So if I need to get a leg up or head's turned around, I want to have that lined up and ready to go within 15 minutes or half an hour. And each stage, whether it's breech, we have a tail or we have a posterior, I just want to be sure that I'm getting things moving out the back end efficiently. And if I'm not, then it's already been discussed as to what is plan B. Is it a live calf? Is it a dead calf? When do we go to a cesarean? And it's been shown pretty often if we have a decent facility, a sooner decision for a cesarean is usually a good one. Cow's in a better shape, calf is in better shape. All in all, if we have the right situation, for a cesarean. So
when we're talking about the beef prices, with where they're at, a cesarean section, folks, is nothing on the cost for what getting a live viable calf that you're going to sell that's going to be $1,600 at the time of weaning. Right.
Yeah, and if you're able to do a good, efficient C-section with a cow in better shape, her chances of breeding back are a lot better than waiting too long. So keep it going.
So cesarean doesn't necessarily preclude or decrease the reproductive efficiency.
Right. Not if it's done efficiently and the decision's made a little bit earlier on, and you have the right setup to do it. It doesn't do that to it.
And a lot of times, if you're wanting to help that veterinarian or help the cow, sometimes just loading her up and bringing her to the veterinarian, they're going to have the right facility. They're going to have the equipment there. It's you're dealing more on your time schedule. It's something that I see more and more is the hauling clinic.
Right, and more efficiency, so a veterinarian can do more at once. You have all the medical equipment that you need to revive that calf. A whole bunch of different medical interventions you can do at the clinic. Plus, everybody's warmer and drier and all that kind of stuff. But in the end, everybody benefits from that, and you do see more haul-in type situations.
Cool. Well, let's take a break. When we come back, let's talk about taking care of that cow and that calf after the calf hits the ground.
Good.
Thanks, Matt. Thank you for watching DocTalk. More here after the break.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner, and we're talking about getting the calf out of the cow. And calving season is upon us. There's a lot of excitement. Dr. Miesner is an associate clinical professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine, where he sees hundreds of cows a year, teaches this. We're fortunate to have him as a guest. It's always good to have you on the show.
Thanks.
You bring great wisdom, and you do a good job, not only with our clients and their animals, but I'm very thankful for what you do for our students.
Appreciate it.
Appreciate you. Let's talk a little bit, Matt, about the post-calving care, and we got to get to that third stage, right?
Right. So we've got the calf on the ground, and sometimes there's some intervention that needs to be done right then and there, as far as resuscitating that calf, and even a slight delay through that pelvis can get them short on oxygen and different things. And so there's a situation sometimes where we've got to intervene within that first 5 minutes, and we have various drugs and treatment protocols that we kind of follow with that. Get them breathing, get some air passage, and then kind of watching the cow as well. So did we have some rough birthing where we have to address some injuries to the cow? Address those right then and there. So that first 5 minutes to an hour is just getting that calf viable and able to sustain itself. And then after that, down the road several hours, the cow should be passing her placenta within 6 to 12 hours, but sometimes they'll retain. And then within that first hour or two, we really want that calf to have its first meal of colostrum too. So either he's going to be viable enough to get up and do it himself, or sometimes it's just easier just to go ahead and strip her out and tube it right then and there, or get him to take a bottle.
And the sooner the better on colostrum, right?
Right. You're within a 24-hour window, long window. I mean, ideally within 6 or 8, they need to have that first bit of colostrum to be absorbed. And then after that, things start shutting down, and they don't absorb it systemically after that. So within that first 6 or 8 hours.
What's your stance on retained placentas? Because I mean, my granddad and dad, we made 100 calls a year on retained placentas.
Right. We want her to pass it on her own at all costs. We don't really want to force it out and strip it. That still shows that causes quite a bit of inflammation. So she might retain it. We treat her, support her, antibiotics sometimes, depending on how healthy she is. But most cows will eventually, get that to loosen up and fall out. It can be pretty horrendous by the time it comes out. But as long as she's healthy, I let her do it on her own. We can do some gentle help, but we don't want to clean them.
Cool. Well, thanks for being on the show today.
Thanks for being here.
Folks, thanks for watching Doc Talk. And if you want to know more about what Dr. Miesner and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Remember, always work with your local practitioner on many of these issues. Thanks for watching Doc Talk today. I'm Dr. Dan Thomson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.